people thinking about healthcare to actually move into healthcare.
Yeah.
I actually have a friend who is a in healthcare. She's a doctor, and she's a jack of all trades. I mean, this woman can do anything that she puts her mind to, for sure. And the cost that she has incurred, just like you were telling those budding doctors, has been exorbitant to the point that, she's refied her student loans to the max, and she's still way above a house payment every single month on those student loans. So when you talk about the money spent versus the value gained, it sounds like, and it's really awesome to hear that you advise the budding doctors on this, that it's really not about the checkbook. It's about how you get up in the morning and how much that you value life and what you bring to the table to all of your patients, which is really cool. I wanted to really commend you on that. That's awesome path to share to everybody, and it means a lot. And it's really enlightening to hear other doctors talk about whether they would tell people yeah or no. Um,
Yeah.
it's
I would do it.
surprising that it's 50-50.
I,
You know?
I would do it again 100 times over. Now, I will say this though, when it comes to medical education, right? There's obviously the higher calling, right, of wanting to do it for all the right reasons. There's also the practical side of it, right?
Yeah.
And I would say there's two things there. First of all, in the United States, we need to evolve our healthcare training. We train 20,000 doctors a year. We graduate 20,000 doctors a year in the United States. It's not enough. It just isn't enough. By the time you actually start practicing, most of us are in our 30s. That's too old. There's no reason that we could not change our medical education program so that people started working years earlier. And then you would, in essence, increase your pool of clinicians, right? That's number one. We could also train more people. We already have a physician shortage in the United States, and we are really not training many more docs each year. So we're falling behind, and we have a clear demand of students that want to be doctors. This whole idea of kind of judging them on how they do on their MCATs is honestly silly. Some of the best surgeons I've ever met are not necessarily great test takers,
Yeah.
but man, are they awesome surgeons. Um, but the last comment I would make is regardless of what you choose to do, whether you want to be a doctor, if you're going into healthcare, if you want to be a social worker, if you want to be a nurse, if you want to be a respiratory therapist, if you want to be, the chief of neurosurgery, whatever you want to do, be practical about it too, right? Are you really going to be a better neurosurgeon because you went to, Harvard undergrad versus if you went to Ohio State? I got news for you. You probably won't be. In fact, I can tell you during my time at Cleveland Clinic, some of many of the best residents that we ever trained um, went to Wright State for medical school. It's a state school, relatively small, Southwest Ohio in Dayton, right? But man, I tell you, those graduates from that medical school were rock stars, absolute rock stars, and they didn't spend $100,000 a year on tuition.
Yeah.
So, think practically as well. And if you have a real calling to be a pediatrician or a family practitioner where your salary is not going to be the same as a cardiac surgeon or a neurosurgeon. Think about that as you're choosing your medical education so that you don't graduate with $500,000 of debt.
Right.
So, practical side of it, I think, is important to keep in mind.